Jock itch, medically known as tinea cruris, is a common fungal infection that affects the skin of the groin, inner thighs, and buttocks. It belongs to a group of fungal infections called dermatophytosis, caused by fungi such as Trichophyton rubrum, Epidermophyton floccusum, and Microsporum species. The name jock itch comes from its tendency to occur in athletes and people who sweat heavily, but it can affect anyone, regardless of age or lifestyle. The infection is usually not serious but can cause significant discomfort and irritation if not properly treated. Causes and risk factors. The fungi responsible for jock itch thrive in warm, moist environments. The groin area, with its folds of skin and frequent exposure to sweat, creates an ideal breeding ground for fungal growth. Some of the major factors that increase the risk of developing jock itch include sweating and humidity. Excessive perspiration, especially during exercise or hot weather, provides moisture that encourages fungal growth. Tight clothing, wearing tight underwear, jeans, or sportswear can trap heat and moisture, creating a suitable environment for infection. Obesity, overweight individuals may experience more skin folds and friction, increasing the chances of fungal irritation. Weakened immune system, people with conditions such as diabetes, HIV, or those taking immunosuppressive medications are more vulnerable. Personal contact and hygiene, sharing towels, clothing, or sports equipment can spread the fungus. Poor hygiene practices may also contribute to its persistence. Symptoms of jock itch. The infection typically begins with a red, itchy rash in the groin area. Over time, the rash may spread to the inner thighs, buttocks, and lower abdomen. Common symptoms include itching and burning. Persistent itching is the hallmark symptom, often accompanied by a burning sensation. Red rash, the affected skin usually appears red, scaly, and irritated. Ring-shaped appearance, in many cases, the rash develops a raised, ring-like border that gradually expands outward. Dryness and peeling, the skin may become flaky or cracked. Discomfort during movement, the rash can worsen with walking, running, or other physical activities, leading to chafing and soreness. Although uncomfortable, jock itch is generally not dangerous. However, if left untreated, the infection may persist for weeks or even spread to other areas, such as the feet, athlete's foot, or nails, onychomycosis. Diagnosis. A healthcare professional can usually diagnose jock itch based on the appearance of the rash and medical history. In some cases, a skin scraping may be examined under a microscope or sent for culture to confirm the presence of fungal organisms. This helps distinguish jock itch from other skin conditions like eczema, psoriasis, or bacterial infections, which may appear similar. Treatment options. Treatment of jock itch aims to relieve symptoms, clear the fungal infection, and prevent recurrence. Management strategies include topical antifungal medications, over-the-counter creams, ointments, sprays, or powders containing clotrimazole, miconazole, terbinafine, or ketoconazole are commonly used. These should be applied as directed, usually for 2 to 4 weeks. Oral antifungal medications, for severe or persistent infections, doctors may prescribe oral antifungal drugs such as fluconazole or itraconazole. Symptom relief, using talcum powder to keep the area dry, wearing loose clothing, and avoiding scratching can ease discomfort. Good hygiene practices, regular washing and thorough drying of the affected area help control fungal growth. Most cases respond well to topical treatment, but it is important to continue applying the medication for the full recommended period, even if symptoms improve early. This ensures the fungus is completely eradicated. Prevention. Since jock itch often recurs, prevention plays a key role in long-term management. Preventive measures include keeping the groin and thighs clean and dry, showering promptly after exercise or sweating, wearing loose, breathable cotton underwear instead of synthetic fabrics, changing clothes and underwear daily, avoiding the sharing of towels, clothing, or sports gear, treating other fungal infections, like athlete's foot, promptly, as the fungus can spread from one area of the body to another. Complications. Although generally mild, untreated jock itch can sometimes lead to complications such as secondary bacterial infection. Scratching may break the skin, allowing bacteria to enter. Chronic infection. Repeated flare-ups may occur, especially if risk factors like sweating and obesity are not addressed. Spread of infection. The fungi may extend to other areas, including feet, nails, or hands. Conclusion. Jock itch is a widespread fungal skin condition that thrives in warm, moist environments, particularly in the groin area. While not dangerous, it causes discomfort, itching, and irritation that can affect daily activities. With proper diagnosis, antifungal treatment, and preventive hygiene measures, the infection can be effectively controlled and recurrence minimized. Awareness of risk factors, early recognition of symptoms, and consistent personal care are the best strategies to manage and prevent jock itch disease.